Hello, this is Michael Lappin from Colorado State University. I'm very excited to be the moderator as well as one of the presenters for this great Purina Institute event. I've been at Colorado State University for almost 30 years, and I've had the chance to start a Center for Companion Animal Studies, which our work is to provide clinical research that helps dogs and cats. It's a great partnership with our friends at the Purina Institute because we all agree on presenting the science associated with topics, in particular today, those topics specific to colostrum and nutrition. My part of the physical lecture is to present some of the great possibilities that would be benefit from feeding colostrum to dogs and cats. I've selected some clinical syndromes that I think you'll find to be interesting for this 25-minute lecture. The first two lectures from our scientists proving the benefit for colostrum in people and in dogs and cats were fantastic, and I hope that you enjoyed them. And now I'm looking forward to speaking with you as a veterinary clinician about the great potential for the use of colostrum in food. I'm very lucky to get to speak for many companies around the world and do many clinical trials. But I agree with the Purina Institute philosophy that these are not product lectures, these are science lectures. And so today, if I do use any materials that are related to a commercially available product, it will only be in published work with references provided to the attendees. I think we've learned a lot today about the proven benefits from feeding bovine colostrum to dogs and cats. Ebenezer's lectures and prior publications are fantastic. The stabilization of the fecal microbiome in the face of stress is going to be a huge theme for me when we talk about the clinical benefits. It's amazing how quickly stress can change our microbiome. And those stress-associated changes can relate to things like diarrhea, predisposition to illness. It's also been great to see Ebenezer's work showing evidence that bovine colostrum, when fed to both puppies or kittens, it's proven now increased fecal IgA suggests that the gut-associated lymphoid tissue is active at a greater level than in placebo animals not fed the bovine colostrum. And then, of course, the two papers showing the increase in rabies titers following vaccination in kittens, as well as this graph showing the prolonged maintenance of high distemper titers, are very compelling that bovine colostrum can be an immune modulator in the positive direction, perhaps making you less likely to become ill if exposed to some of these agents. So what I would like to do with my 20 minutes from this point is talk about several of the potential clinical benefits from feeding bovine colostrum. I'd like to start with a discussion about the feline upper respiratory disease complex in cats. There are so many organisms, and each of those agents can be potentially very significant to the health of those cats. So let me show you two images of classic syndromes. The kitten is a feline herpes virus 1 infected cat. This is from an experimental study. And as you can see, the rhinitis and conjunctivitis can be very significant. The older cat with the mucopurulent discharge, this is one of the cats that helped turn my hair this color. It's a chronic recurrent rhinitis cat. Antibiotic responsive, but still recurrent. Both of these are potential examples for what happens with chronic feline herpes virus and sometimes Colostrum virus. Severe initial disease and chronic recurrent disease in the future. The primary bacterial infections, for sure, include Bordetella bronchoseptica, especially if you have a concurrent dog in the family with canine infectious respiratory disease complex, the dog infecting the cat. Chlamydia felis in our catteries, and mycoplasma, especially Mycoplasma felis, in those catteries, as well as a high incidence in the shelters. So these three primary pathogens are the community-acquired bacteria that can make you sick if you're a cat by themselves. The secondary bacterial infections, they generally occur after another problem. And for today's lecture, especially secondary to herpes or Colostrum virus infections. These are our normal bacteria, but they can overgrow if herpes or Colostrum virus cause their trauma first. Each of these on the list can be a primary cause of disease with a secondary bacterial infection. But when we think about chronic recurrent disease, feline herpes virus and feline Colostrum virus are still the major players. The influenza viruses of cats, they tend to be very short-lived, their illness. And even our hated SARS-CoV-2, the cause of COVID-19 in people, when it infects a cat from exposure to an infected human, the degree of illness is very mild and very transient. However, there are two potential benefits from feeding bovine colostrum and all those great immune modulatory activities that we've discussed in Ebenezer's lecture. What if you were on an immune enhancing substance like bovine colostrum when you were first exposed to one of these primary pathogens? Well, since it's a known immune modulator in the positive way, immune stimulant, we would predict that the illness would be less severe. And so one of the benefits of feeding colostrum would be to lessen illness if exposed to one of these primary pathogens. The other pathway of interest, we believe that the chronic rhinitis cats due to herpes and colici, that's an immune-mediated event. And so by having immune modulation, we might be able to put a chronically affected cat in remission. An exciting new area for research for use of bovine colostrum. I also wanted to point out the lactoferrin that Ebenezer mentioned in his writings. Yes, lactoferrin is a natural antibacterial substance, and I'll show you in stomatitis in a few minutes. Feeding lactoferrin can put stomatitis in remission in cats with feline immunodeficiency virus. And so very exciting potential work in both of those pathways, lessening severity on first exposure to a pathogen, and perhaps helping put a chronic pathogen in remission. Bovine colostrum has a lot of potential for this syndrome, in my opinion. Now, Ebenezer's work that was already published showed that you could lessen changes in the GI or gastrointestinal microbiome in periods of stress. I wanted to share with you in this section of the lecture a model that we developed several years ago. We've been able to show all you have to do is take cats that are living in group housing and put them into cages, or move them from cages into group housing, like in Ebenezer's great paper, and that will cause enough stress to change your microbiome. It's amazing. This is from one of our publications looking at a probiotic versus placebo. And we showed clearly that changing housing is enough to change that microbiome. And just like with the probiotic, feeding bovine colostrum could lessen that microbiome change. And of course, that would have many potential benefits over time to have a more stable gastrointestinal microbiome. Here is one of the medical events that we showed being beneficial to be either immune enhanced or having a more stable microbiome. In this paper, we were able to show that an immune enhancing probiotic, which also stabilizes the microbiome, could actually lessen reactivation of herpes conjunctivitis. We would presume that those same findings would occur with bovine colostrum because it also stabilizes the microbiome and has immune stimulatory properties, just like the probiotic used in this work. Now, we have to use antibiotics as veterinarians, but when we do, oral antibiotics, as well as some of the injectable antibiotics, can change our microbiome and ultimately cause diarrhea. In fact, antibiotic diarrhea in people is extremely common, leading to some regions and countries having their own guidelines for using things to stabilize the microbiome, like probiotics. That work is now starting also in veterinary medicine, using the GI microbiome stabilizing probiotics to lessen vomiting or diarrhea associated with antibiotic use. I wanted to remind you of the fecal scoring system that's been published by Nestle Purina, with a score of 7 being the worst, with mainly water. Look what happened when we fed 27 cats amoxicillin clavulanate. 23 of 27 cats developed diarrhea, significant diarrhea, with a 6 or a 7. Yes, antibiotics are hard on your gastrointestinal microbiome. And in that work, we were able to show stabilizing the microbiome with a probiotic was able to lessen antibiotic diarrhea. And so what I'd like to propose to you today, that the use of bovine colostrum, if you were already feeding a diet that was supplemented with bovine colostrum, that GI microbiome stabilization, you would be less likely, in theory, to have antibiotic diarrhea. So another potential pathway of clinical use of bovine colostrum, potentially lessening antibiotic diarrhea if they were already being fed that food, will be an excellent area of research in the future. Stress diarrhea is common in both species, dogs and cats. And in dogs, I think we all believe Clostridium perfringens, which is a normal flora, is probably the most important agent. And during stress events like housing change, like being housed in a boarding facility, is commonly associated with diarrhea. And so I would submit the hypothesis that since we know bovine colostrum helps stable that microbiome, we would see less stress colitis in animals that were currently being fed that type of supplemented diet. And as we all know, the sooner your diarrhea resolves, the better for everyone. Less of a mess for the owner, less discomfort for the animal. And I also wanted to remind you that normal feces from dogs and cats rarely has enough of a human pathogen to be dangerous. Whereas if this 7 on the Purina scale is carrying salmonella, that would be much more dangerous for the owner. And so if feeding a bovine colostrum supplemented food, stabilizing that gastrointestinal microbiome, as well as supporting immune health, might lessen the occurrences of stress diarrhea in those patients or pets. I wanted to share with you one of the new recommendations from those of us interested in the gastrointestinal microbiome. We no longer recommend giving oral antibiotics from the start. We would much rather the veterinarian treat a suspect bacterial diarrhea case by feeding the appropriate diet for either large bowel or small bowel diarrhea. And currently, we're recommending using a probiotic instead of an antibiotic. But what I would like to suggest to you today is that if you're eating a bovine colostrum supplemented diet every day, your microbiome, in theory, is already stabilized, and you're probably immune enhanced over long term, making it less likely you would have diarrhea if exposed to one of the primary pathogens, Campylobacter, E. coli, or Salmonella. An interesting potential benefit from feeding a diet of this type. And I look forward to help performing those clinical studies to prove the hypothesis to be correct. And then the last thing for us with our 4 minutes of remaining time is everyone on the call today that gets to work with cats has seen the horrifying caudal stomatitis or caudal mucositis in cats. As we know, that syndrome occasionally requires pulling all the teeth up until healthy tissue. But we also know pulling all the teeth still has a failure rate of about 40%. And so I want to familiarize you with the theory that this is an immune dysregulation. They're having an inflammatory process to a trigger that's common to all cats. And I believe the data suggests Kalishi virus is the number one. There's excellent information from our friends at Bristol suggesting, based on the types of immune responses in the tissues, that it's an aberrant or a dysfunctional immune response. And as you look at those papers, you will learn that the types of dysregulation fit best with a viral trigger. In work performed in my laboratory, which has been replicated in Europe as well as other countries, that it appears that the number one trigger is feline Kalishi virus. And of course, if you have feline immunodeficiency virus, that's also a known trigger. How that relates to today's lecture is if you were being fed bovine colostrum supplemented food, you in theory would have a better immune function, maybe immune modulation that could help control this syndrome, or perhaps even keep it from occurring. One of the major benefits from bovine colostrum may be to lessen the odds that you'll develop severe disease due to respiratory, antibiotic diarrhea, stress bacterial diarrhea, or even mucositis. I draw your attention to a paper from over 20 years ago where it was first shown that supplementing cats with stomatitis and FIV could help control their mucositis. Lactoferrin is present in bovine colostrum. It's a very interesting hypothesis for how this type of diet may be beneficial to your patients. So again, in summary, Dr. Ebenezer's work has shown great data that there's proven benefits to the immune system and the GI microbiome. I hope that my clinical analogies and areas of study in the future were beneficial to you today. And now I look forward to moderating the questions and answers for all three of our speakers. And thanks to the Purina Institute for bringing us all together today.